name's Dave Schutter, and I'm a general surgeon with Premier Surgical of Knoxville. The diseases I treat typically are kind of the whole gamut of what general surgery encompasses. I was fortunate enough to do a fellowship in robotics and laparoscopic surgery, kind of an advanced gastrointestinal fellowship, where I got to do kind of advanced training with foregut diseases such as GERD or hiatal hernias, but also worked with a great surgical oncologist and colorectal surgeons. I got to do a lot of colorectal surgeries as well as kind of hepatobiliary and other kind of malignancy type surgeries. What I like to treat the most is just kind of when people get to come in with just these acute problems, I get to be the quick fix for them, you know, in a lot of circumstances. I just love that. Love being able to do a small operation, sometimes larger operations if it necessitates, but really getting to be an interventionalist and changing somebody's course. So that's my favorite part. I wanted to pursue minimally invasive surgery because I wanted to be at the leading edge of where general surgery is going. I think being able to do these larger and more complex operations with smaller incisions and with laparoscopic or robotic technology is only benefiting the patients, and it's only getting better as we go. So the fellowship for me was kind of a ways to expedite my training and get as far as I can as soon as possible. Special focus areas for me, anything foregut surgery, anything colorectal. I love doing and being a surgeon in that capacity. I love taking care of hernias and gallbladders for people and even lumps and bumps. Really anything that a patient has a need of that a general surgeon can cover, I'd love to be that guy to be able to help out. So I started training University of Nebraska for undergrad, and then I did University of Kansas Medical School in Kansas. I then moved on to residency in general surgery in Western Michigan, and then I did 1-year fellowship of advanced GI, which is minimally invasive surgery in Tacoma, Washington. I was born in Michigan, lived in Oklahoma, Nebraska, then again in Kansas, Nebraska, Michigan, Washington, and now Tennessee. So I've been all over. I didn't decide to go into medicine until I was 20, so I was about to graduate with a psychology degree from undergrad. I went on a lot of mission trips growing up, so I think a lot of people's medicine passion sometimes starts in a similar fashion, but for me, I was building tiny little houses and super proud of my house, even though, I mean, it was terrible. But we had a general surgeon there, and he saw a bunch of people and treated a lot of people, and I just thought that was really cool. So went home and shadowed him in small town Hastings, Nebraska at that time. And a week later, I changed my major and added a victory lap onto college and ended up doing medicine, and that's all I've done ever since. I've got 2 boys, Emmett, the oldest is 3, and then Cy is 1. So he's just starting to walk, but they love going on adventures, as Emmett says, all the time. Let's go on an adventure. So we get out and my wife will have a pack with one and I'll have a pack with the other, and we go hiking. Music is one of my hobbies that I'm kind of passionate about. It takes a little bit of a backseat when you got 2 little toddlers running around, but I've always been involved in music my whole life, whether that was choir and a band, and then picked up the guitar in high school and kept playing with that ever since. Been fortunate to be with a couple of different bands kind of growing up in different stations of my life, and played in bands from, rock music from when I was younger to blues music to kind of country rock music, that sort of thing. So now I got to find a new band here in Tennessee because I don't have one yet. My philosophy of care, I try to teach or treat patients just as like a friend or kind of a family member, honestly. Just totally open. I try to speak in terms that are just normal for everybody. One of my favorite things is a lot of people say, "You don't seem like a surgeon," which I always take as a compliment because I just maybe can relate to people decently and try not to talk above them by any means or use terms maybe they don't understand or something like that. So the good and the bad, I try to shoot them straight every time.